Hello, science fans! Today we're going to explore something very important: opioids. Now, what are they? Opioids are a class of drugs. They come from the opium poppy plant, but many are also made by scientists in a lab. You might have heard of some of them, like morphine, oxycodone, or fentanyl. For a long time, doctors have used these powerful substances to help people who are in a great deal of pain. Think about someone who has just had major surgery, or someone with a very serious injury. The pain can be overwhelming, and that's where opioids come into the picture. They are some of the most effective pain relievers we have. So why are they so good at stopping pain? It all comes down to chemistry and our own bodies. Opioids are used to treat what we call acute pain, which is severe, short-term pain from something like a broken bone. They can also be used for chronic pain, which is pain that lasts for a very long time, although this is becoming less common due to the risks involved. When a doctor prescribes an opioid, it's a very serious decision. They weigh the benefits of relieving someone's suffering against the potential dangers. The goal is to make the patient comfortable so their body can heal properly without being overwhelmed by constant, severe pain signals. Let's consider this. Our bodies have an amazing built-in system for managing pain. But sometimes the pain is just too much for our natural system to handle on its own. It's like trying to stop a flood with a small bucket. In these cases, doctors might decide to prescribe an opioid to give the body a major helping hand. The medication essentially steps in to do the job that our body is struggling to do. It's a powerful tool in the medical toolkit, designed for the most serious situations where pain is preventing a person from functioning or recovering from an illness or injury. It's all about helping people through a really tough time. The use of these medications is a testament to how much we understand about the human body and chemistry. By studying the poppy plant, scientists were able to understand the specific molecules that could interact with our nervous system. This led to the creation of medicines that can target the pain pathways in our brains and bodies with incredible precision. But with great power comes great responsibility, both for the doctors who prescribe them and the patients who use them. It's a fascinating and serious topic, so let's dive deeper into how these molecules actually work inside of us. Consider this: science is all around us and inside us too. To understand opioids, we first have to understand how our brain and nerves work. Imagine your nerves are like a giant system of telephone wires running all through your body. When you stub your toe, a pain signal is sent zipping up those wires, from your foot all the way to your brain. Your brain receives the message and says, "Ouch, that hurts." This system is essential for survival, because it tells us when something is wrong so we can react, like pulling your hand away from a hot stove. It's your body's natural alarm system, keeping you safe from harm every single day. Now, our brains are very clever. They don't just receive pain signals, they can also control them. Your brain has special places called receptors. Think of these receptors as tiny locks on the surface of your nerve cells. Your body naturally produces chemicals, like endorphins, that act as keys for these locks. When you exercise or feel very happy, your body releases these endorphins. They fit into the opioid receptors and can block pain signals, which is why a runner's high can make you feel so good. These endorphins also activate the pleasure and reward centers of your brain, making you feel happy and calm. Here's where the science of opioids gets really interesting. The molecules in opioid drugs are shaped very similarly to our natural endorphin keys. When someone takes an opioid medication, these drug molecules travel through the bloodstream and up to the brain. There, they fit perfectly into the same opioid receptor locks that our endorphins use. However, these drug keys are much stronger and more powerful than our natural keys. They don't just block the pain, they slam the door on it, preventing the pain signals from ever reaching the brain's ouch center. It's an incredibly effective way to stop pain in its tracks. So, when these powerful opioid keys unlock the receptors, two major things happen at once. First, the pathway for pain signals gets shut down. The message from that stubbed toe or surgical incision simply can't get through. The person feels relief from their suffering. Second, these keys also unlock the doors to the brain's powerful reward system, causing a huge flood of a chemical called dopamine. This creates a strong feeling of pleasure, calm, and well-being. It's this dual action, stopping pain and causing pleasure, that makes opioids so effective, but also so potentially dangerous. Let's compare what happens in the brain with and without opioids. Normally, when you feel pain, your nerve cells release signaling chemicals to pass the message along. At the same time, your brain might release a small controlled amount of natural endorphins to help manage that pain. It's a balanced system. The pain alarm goes off, and your body's own management team steps in to keep things from getting out of control. This natural response is usually enough for everyday bumps and bruises, allowing us to function while our bodies heal without being completely overwhelmed by the sensation. Now, let's introduce an opioid. When the drug enters the brain, it doesn't just send in a small management team. It sends in a whole army. The opioid molecules bind to the receptors on the nerve cells with great force. This action completely stops the nerve cells from releasing their pain-signaling chemicals. It's like cutting the telephone wire so the message can't be delivered. The result is profound pain relief, far more powerful than what our natural endorphins can typically provide. This is why opioids are so valuable for severe pain. They offer a level of relief that our bodies simply cannot achieve on their own. But this powerful effect comes with significant risks. The same flood of opioids that blocks pain also causes that massive release of dopamine, the feel-good chemical. This creates a powerful sense of euphoria that is much more intense than any natural reward. The brain's reward system is designed to remember things that are good for survival, like eating tasty food. When it experiences this huge, unnatural surge of pleasure from an opioid, it creates a very strong memory. The brain essentially learns that this drug produces an amazing feeling, and it starts to want that feeling again. This is the very beginning of the pathway to addiction. This intense activation of the reward pathway is the double-edged sword of opioid use. On one side, you have incredible, life-changing pain relief. For someone in agony, this can feel like a miracle. On the other side, you have a potent, chemically induced sense of pleasure that the brain can quickly learn to crave above all else. The brain isn't designed to handle such a powerful and artificial stimulation of its reward circuits. This imbalance is what makes even prescribed, short-term use of opioids a delicate matter that requires extreme caution and medical supervision to prevent the brain from starting down a dangerous path. So how does this lead to addiction? It starts with a process called tolerance. If someone uses opioids repeatedly, even for a legitimate medical reason, the brain tries to adapt to the constant presence of the drug. It becomes less sensitive. The opioid receptors can get tired of being so heavily stimulated. To get the same amount of pain relief or the same feeling of pleasure, the person needs to take more and more of the drug. This is tolerance. It's the body's way of trying to get back to its normal state, but it creates a dangerous cycle of needing higher doses. As tolerance builds, another process called dependence can begin. The brain gets so used to the opioids doing the job of managing pain and pleasure that it stops producing its own natural endorphins as much. The body now relies on the external drug to feel normal. If the person stops taking the opioid, their brain is left without its artificial keys and with very few of its natural keys. The result is withdrawal. The pain signals come roaring back, often worse than before, and the lack of dopamine leads to terrible feelings of sickness, anxiety, and depression. This intense discomfort is a powerful motivator to take the drug again, just to stop the withdrawal symptoms. This cycle of tolerance, dependence, and withdrawal is the biological basis of opioid addiction, or what doctors call opioid use disorder. The brain has been chemically rewired. The person is no longer taking the drug to feel good, but to stop feeling terrible. Their brain's powerful survival instincts have been hijacked, prioritizing the drug over everything else. It's not a moral failure or a lack of willpower. It is a chronic disease of the brain, just like diabetes or heart disease, that requires medical treatment and compassionate support. Understanding the science helps us see it for what it truly is. But there is hope. Science is not only helping us understand addiction, but it's also giving us tools to fight it. Medications can help manage withdrawal symptoms and reduce cravings, giving the brain a chance to heal and rebalance. Therapy and support groups help people develop coping strategies and rebuild their lives. Researchers are working hard to develop new, non-addictive pain relievers and better treatments for addiction. For anyone struggling, the most important step is to ask for help. With the right support and treatment, recovery is possible. Science gives us understanding, and with understanding comes hope.